This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman.
And I'm Nermeen Sheikh. Welcome to our listeners and viewers around the country and around the world. The federal government has confirmed over 100 people across 14 states have now developed measles. Public health officials suspect the outbreak, which is concentrated in California, began when an infected person visited Disneyland in Anaheim in December. On Wednesday, Dr. Jeffrey Gunzenhauser, Los Angeles County's interim health officer, updated reporters on the outbreak.
The outbreak of measles that we're currently experiencing is the largest that we've had in this county and in this state in 15 years. Public health is doing all we can to identify cases and to isolate contacts so as to prevent spread. However, to end this outbreak, we need to do more, and we need help. I encourage everyone to review their vaccination status and, if needed, to get the vaccine now.
15 years ago, the Centers for Disease Control and Prevention proclaimed victory over measles, but in recent years there's been an increase in outbreaks as a growing number of parents have opted not to have their children vaccinated, claiming a link between vaccines and autism. The prestigious medical journal Lancet published a study in 1998 showing such a link, but the study was later retracted and has been widely discredited. According to the CDC, 1 in 12 children born in the United States is not being vaccinated as recommended. On Wednesday, 2 California lawmakers announced a bill to eliminate, quote, personal belief exemptions that allow parents to refuse to vaccinate their children. The state has allowed such exemptions since 1961, when it first required all public school teachers and students to be inoculated against polio. But since 2000, the rate of parents seeking exemptions has tripled to about 1 in every 40 children. Meanwhile, Senators Dianne Feinstein and Barbara Boxer asked state health officials to go further and eliminate, quote, religious exemptions.
Several potential Republican presidential candidates have also weighed in on the debate. On Monday, Kentucky Senator Rand Paul, an ophthalmologist, said he'd heard of instances where vaccines caused mental disorders.
The hepatitis B vaccine is now given to newborns. We sometimes give 5 and 6 vaccines all at one time. I chose to have mine delayed. I don't want the government telling me that I have to give my newborn hepatitis B vaccine, which is transmitted by sexually transmitted disease and or blood transfusions. Do I think it's ultimately a good idea? Yeah, and so I had mine staggered over several months. I've heard of many tragic cases of walking, talking, normal children who wound up with profound mental disorders after vaccines. I'm not arguing vaccines are a bad idea. I think they're a good thing. But I think the parents should have some input. The state doesn't own your children. Parents own the children, and it is an issue of freedom.
That's Senator Rand Paul on Monday. Since then, he's backtracked on his comments. On Tuesday, he was photographed receiving a hepatitis A booster shot at the Capitol to show his support for vaccinations. But Senator Paul has deep ties to vaccine skeptics. For 20 years, he was a member of the Association of American Physicians and Surgeons, which has backed a moratorium on vaccine mandates. Meanwhile, another possible Republican presidential candidate, New Jersey Governor Chris Christie, was questioned about vaccines during his trip to England.
Do you think Americans should vaccinate their kids? Is the measles vaccine safe?
Well, all I could say is that we vaccinate ours. And so, that's the best expression I can give you my opinion. It's much more important, I think, what you think as a parent than what you think as a public official. What I said was that there has to be a balance, and it depends on what the vaccine is, what the disease type is, and all the rest. And so I didn't say I'm leaving people the option. What I'm saying is that you have to have that balance in considering parental concerns.
New Jersey Governor Chris Christie's spokesman later said the governor believed kids should be vaccinated against measles. Well, for more, we're joined by several guests today. Later in the broadcast, we'll speak with Mary Holland, the mother of a child with regressive autism, who she believes was injured by the measles, mumps, rubella vaccination known as the MMR vaccine. And we'll speak with Dr. Paul Offit, professor in the Division of Infectious Diseases and the director of the Vaccine Education Center at the Children's Hospital of Philadelphia.
But first, we're joined now from San Francisco by Dorit Reiss, professor of law at UC Hastings College of the Law. She specializes in legal issues related to vaccines, including exemption laws. She co-authored a report last year about, quote, funding the costs of disease outbreaks caused by non-vaccination. Professor Reiss, welcome to Democracy Now! So could you lay out for us what you think the key issues are regarding exemptions on children getting vaccinated?
Of course. So first, thanks for having me. The starting point is that we have a tension between three important values. The first is parental rights. Parents have rights. We care about their ability to take care of their children, guide their children. The second is the public health. We want to make sure that the public is protected against infectious diseases and other problems. And remember, the public includes other people. Other parents and other children have rights to be protected against disease as well. And the third is the right of a child. Given the incredible imbalance between the risks of vaccines and the risks of not vaccinating, with the risks of vaccines very small and the risks of not vaccinating much larger, there's a strong argument that the right to health of the child means that the child should be vaccinated. The combination of that is part of what supports the state's right to impose school immunization requirement. School immunization requirements have been in the states since the 19th century at least, and in the first years we didn't have exemptions. Exemptions are relatively new during the 20th century, and in terms of exemption, as you probably know, we have three types. We have medical exemptions, which all states have. We have religious exemptions, or personal belief exemptions, also known as philosophical exemptions. And 48 states, every state except West Virginia and Mississippi, have either a personal belief exemption or a religious exemption or both. The issues that come up is how broad should the exemption be? And states vary dramatically on that. California, for example, is right now one of the broadest. And that's part of the reason behind the change.
So this issue, for example, of Mississippi, even though something like 24 lawmakers wanted to support this exemption based on conscientious beliefs, they are in the vast minority here of states. 48 states, as you said, allow for a conscientious objection, saying no public or private school student can go without a vaccine.
That's correct. Most states allow either personal belief or religious exemption, and that has been started around the 60s as well. Mostly, my best reading is because of the high value we place on personal freedom and on religious values. And I'd expect that most states that adopted religious exemption expected them to be very limited, mostly to Christian Scientists and other small sects. That's not what happened. In many states, religious exemptions are used much more broadly than by the very small sects that have strong views against vaccination. And our jurisprudence makes it very hard to limit religious exemptions only to those religions that really object to vaccination.
But do you believe, Professor Reiss, that with the latest outbreak, now states will reconsider the extent and range of these exemptions?
Yes, I think we're already seeing that. We're seeing several states consider following the Western states, California, Oregon, and Washington, and adopting an educational requirement in addition to the personal belief exemption. We're seeing this discussed in Maine, in Minnesota, and in other states. And as you've seen, California has recently been reconsidering its own exemption law. So I would expect a move to more restrictive exemptions. And given what we're seeing, the rise of outbreaks, that's all for the good.
Well, explain why that is so important, why parents shouldn't be able to opt out. In a moment, we're going to hear from a parent who feels very differently from you.
So remember what we're talking about. We're not talking about telling parents, whether you wish to or not, we're going to tie your child down and vaccinate them. That's something that, if done, is done only in extreme circumstances. We're talking about the question whether a parent can send a child to a school, public or private, unvaccinated. if a child is sent to school unvaccinated, first of all, the child herself is at risk. But in the atmosphere of the school, the child also puts others at risk. First, directly, if the child who is unvaccinated and higher risk of disease contracts the disease, they may infect someone else. And second, by reducing the level of immunity in the school, by undermining herd immunity, the school is more vulnerable to an outbreak.
Just for people who are not familiar with this debate, Professor Reiss, when you say herd immunity, explain what you mean.
I hope Dr. Offit will talk about this more in detail, but basically the idea is that if we have a certain number of people immunized in the school, those people form kind of a ring around the few that aren't immunized and prevent the disease from reaching them. That's the idea of herd immunity. If you have enough people immunized, even if one person who's infected comes into the school, the disease won't spread.
You've also suggested, Professor Reiss, that parents who choose not to have their children vaccinated are almost always negligent under the law. So do you think that there should be legal consequences for parents who choose not to have their children vaccinated?
Yes, I do. And my point of view is less focused on the parent that doesn't vaccinate. We need the behavior to be negligent to impose consequences, but more on those harmed by the decision. If one parent chooses to reject expert opinion, to choose for their own child the bigger risk, the risk of not vaccinating, over the smaller risk of vaccinating, and something happened that harms another family, I think it's unfair to make the other family pay for the costs of the first family's decision. Again, think about the situation. A child is left unvaccinated, contracts measles, passes it to an immunocompromised child that suffers serious complication. The family of that child has emotional costs, the child that suffers pays a physical price, and they have financial costs. Why should they have to pay for someone else's choice?
Is there any kind of legal precedent for that, though?
Not at this point. The case has simply, to my knowledge, not come up. We have other cases of liability for infectious disease. We have a case of liability when someone went into a boarding house that has pertussis, whooping cough, and wasn't told that there was a whooping cough, and his children caught whooping cough. We have liability for sexually transmitted diseases if there was negligent non-disclosure. So we have a history of liability for infectious disease, but this context hasn't come up yet.
Are you saying that parents, what should happen? What should be the consequence for parents who doesn't immunize their child, vaccinate their child? Are you saying they should be jailed?
No, I'm not. There's a whole range of possible consequences. I've heard the idea of jailing parents in that situation, and I think that's going substantially too far. A parent making the decision is making the decision on their best judgment. There's a lot of misinformation out there, and it's natural for the parent to make the wrong decision for the child, and it's a decision that puts their own child first and foremost at risk. I don't think the level of culpability is high enough to justify criminal law. But I think it's fair to tell the parents, you made the decision, you internalize the consequences. Take personal responsibility. Nobody else should have to pay for that. You're going against expert opinions, you're going against the science, you're going against the credible data. Why should others carry the cost? And that's true for another family if they're infected, or the public health. These outbreaks cost a lot of money to contain, and that money comes from somewhere. Public health departments are cutting other budget and not doing other things in order to track down and contain measles. Why should the public pay rather than those that made the decision that led to the outbreak?
Dorit Reiss, we want to thank you for being with us. Professor of Law at UC Hastings College of Law, specializing in legal issues related to vaccines, including exemption laws. We'll link to your piece, Funding the Costs of Disease Outbreaks Caused by Non-Vaccination. When we come back, a very different view. We'll be joined by another lawyer, by Mary Holland, a research scholar at NYU School of Law, advisor to Health Choice. This is Democracy Now!, democracynow.org, The War and Peace Report. Back in a minute.